I'm here with Brian Clement. He's the director of the Hippocrates Health Institute, and he's been the director now for over 40 years, which is pretty much the oldest, most prestigious complementary health center in the world. And we've talked before, and it got great reviews. Everyone loved listening to it. I have kind of two things that I want to touch on today. One is I've devoured everything that I can hear about you. And what you've put out there, especially the new stuff that I've seen on YouTube, the 2014 stuff in the conference, amazing stuff, especially for this time and day, which I think we so need a powerful mindset and a healthy mindset and a loving and a compassionate mindset. And not from a woo-woo point of view, but from a, hey, shit's hitting the fan now, and we need people to get up off their asses and say, hey, this is important. We need to look at this and to have some strong men, women, people in general. So before we get into that part of it, I have my own questions that I'm really curious about on your point of view, because I trust your judgment and everything that you've studied. So if you don't mind if I could go down the list and then we'll jump into the second part.
I'll be happy.
Okay, cool. So I read a lot of stuff, and this is kind of going a little bit on the extreme side, but what is your thought upon urine therapy? When I'm reading a lot of stuff about urine therapy, some people say it's great, and I'm just curious on what you think about that.
This is a really interesting story. About 1976, we received a call. It was with Ann Wigmore, the founder of Hippocrates, and some voice came on the phone and said, "Hello, this is Prime Minister Desai from India. We'd like the great healer Ann Wigmore to come and help to heal people in my country." And I thought it was some joker I knew from New York. So I actually was ready to hang up, but I put Ann on to hear the joker. And it turned out to be the Prime Minister of India. Wow. And before you know it, we were over there in the late 70s. And I was stunned. This is the first time I'm in the presence of a Prime Minister or anything of a country. And when you're wealthy in India and at that level, he, as many other the wealthy, had their own medical doctor, and because of who he was, naturopathic doctor. He was interested personally in this type of a lifestyle. And he starts talking in his deep Indian accent about urine therapy. Now, I frankly, in 1977, 8, I didn't know a thing about urine therapy. And I thought, is this surrealistic or not? Did he say urine, or am I misunderstanding the word? So as soon as he departed the room, I ran over to the medical doctor, and he sat down for about an hour, it was great, and explained to me that urine has antigens and antibodies in it, that it literally provokes the immune system to function the way that it should. Now, does it have a valid effect in many cases? And the answer has to be yes. And this has been a traditionally well-used treatment thousands of years ago and hundreds of years ago. Now, here's my preface upon that. Would I suggest it? The answer is no. It's hard enough to get me to have people drink wheatgrass here. Now, to get PP therapy, forget it. But the reason why is because we also have a slew of chemicals and heavy metals, and God knows what diet you're on, because you reintroduce that back into the system. Because obviously the urinary tract has one objective, and that's to push waste out of the system. And for that reason alone, we don't, I wouldn't say we don't support it, we don't promote it. Okay. Now, my colleague, Louise Hayes, and I give her a lot of credit for this, back at the beginning of the AIDS epidemic, she was the most courageous one that stood up and said, look at these poor boys, because at that point it was almost 100% exclusively homosexual men. She said these poor boys are being shammed, that what they were doing is giving them a drug that had been taken off the market in the late 50s because it was killing people. It was a cancer drug, and there was so much hatred for the gay community at that point, they literally justified somehow in their ill minds that this was perfectly fine. They were charging them $1,800 to $1,900 a month. It wasn't working. Nobody was willing to do research. And she went and helped them, and one of the things they used was urine therapy. Now, this is where I really learned, in the very early 1980s, I really learned about the advantage of this. Because I was seeing blood profiles and immunological profiles. It was the first time any of us in medicine or healthcare really started to look seriously at the immune system. Up until then, and everything bad does something good, and what AIDS did is it got everyone to shake themselves up and say, wait a minute, If AIDS is because an immune system is weakened and it's taking over the body and killing people, maybe what I learned in 101 pre-med was also something applicable. Maybe cancer comes from that, and viruses come from, not come from it, but basically precipitate or grow if you don't have a strong immune system. So we would look at immune system profiles, and no question, the young men that were literally partaking upon this had improvement. I'm not going to say they all got well and they got better, but the fact is you can't scientifically say it wasn't so. It was so, and I saw almost unanimous changes once they did this.
Okay, good. So my wife can start kissing me again in the morning. That's great. Okay, perfect. That's one of the questions. So the second question is, what is your opinion about H2O2? Food grade quality, of course, diluted in water, maybe from 1 to 2%. I don't like to get too much into 3%, as far as introducing oxygen into your bloodstream.
Well, that's the old-fashioned method. And what happened is a few years ago, let's explain to the listeners what we're talking about. Okay. We're talking about an oral form of oxygen therapy. Now, what we knew well back in 1924, when Otto Warburg published his study, he started that study in 1920, and 3-4 years later published this. And later on, in the early 40s, I believe, he received his Nobel Prize. His whole life was that cancer was a metabolic disease, and in the presence of enough oxygen, cancer would not exist. I'll add also microbial problems. No major disease could exist if some magical way we could take all of your 100 trillion cells and expose it to adequate amounts of oxygen. So he proved it and won the Nobel Prize for it, and then we forgot. And of course, the money grubbers came in and said every disease is genetic and you're helpless and you can't do anything and you've got to take these drugs and just roll over. Let us manipulate you. But there are still great doctors, great doctors, like Dr. Seinfeld out of Boston College that wrote the Bible on this, cancer being the metabolic disease, that will tell you that Warburg was right and has incredibly endowed his work with what work he's done at Boston College. Other doctors around the country and around the world are doing that. And we hold conferences here with these doctors at times. Now, with that said, any way you can increase oxygen in the body is great. Now, you know, because of who you are, if you take green vegetables and sprouts and juice them and drink them immediately before that oxygen goes into the atmosphere, you're going to get oxygen that way. You know, exercise. If you exercise adequately, aerobically, you're going to get oxygen that way. We also know here for 20 years we've been using hyperbaric chambers for people. In this country, it's approved for post-operative healing. And if a person has a wound that won't heal with a medicine or any other way, you get in there and that almost assures that you're going to heal 98% of all wounds. But the other way is inexpensive and widely available that you're alluding to. That's where you take hydrogen peroxide, and it's O1, and you put that into water and highly dilute it. Now that was old school, not the worst thing in the world if you dilute it down to 1 to 65. But they years ago started to create stabilized oxygen. That's far more advantageous for you. This literally brings lots more oxygen in. So you can go out to your local health store and get a product that's widely available like Cell Food. There's others, but Cell Food is a perfect one. We've been telling people about that and others for decades. And that really does increase oxygen. We have oximeters here that we use. And even with the oral forms of stabilized oxygen, you see an average increase after 14 days of taking it of 2.2% oxygen increase. Oh, wow. And so great stuff.
Okay.
Where the peroxides, or diluted peroxides, we got less than 0.5.
Okay, great. And the same thing with, I have one of those ozone, basically it's an ozone maker. I just put this little cord in water, in my distilled water, and I basically do that for 5 minutes and ozonate it. And is that as effective as getting it into your body?
It's extremely effective. As a matter of fact, again, you can't let it bubble out into the atmosphere. You have to drink this readily. So you, as you know, you bubble it in, you put the oxygen in there, and that's O3, by the way. That's not O1 like this is an O3. It goes into the water and then you drink it immediately. We used to have those units here years ago. They broke and we weren't able to find new ones that were actually little type of water dispensers, the type you would see in an office, and you turn it on and put oxygen directly into it.
Okay.
But great stuff, can
Good.
be helpful. You get on that one about the same. You get 2.14 or something, almost the same you would get from the stabilized oxygen.
Okay, thank you on that. And the next thing I'm curious about is ORAC value. You've seen this all lately on bottles and things that, you know, ORAC 40,000. Is that a joke, or is it one of those new little scams?
It's not a joke. It's a bit of an embellishment. Let me just talk about that. The ORAC, really, when you're looking at this, comes from an ionic frequency, and it's a decomposition of matter that creates ORAC. Now, how effective that is or how beneficial that is, nobody's established that. I mean, let me just put it this way. It can't hurt you. I just don't know how much it can help you.
Okay. All right. Just was wondering about that. Now, one thing I'm real curious about, and I saw this and it kind of opened my eyes up. I follow a full 100% vegan diet, and I was curious because we talked about no other animals really eat other animals when we're talking about primates. Yet I was watching on YouTube, there was chimpanzees, and they all went after a monkey and they started eating the monkey. And so that was kind of, I was curious on your thoughts on that and what you think was going on there.
Well, what you have to know is that we creatures are not the only abnormal ones that have disturbed our environment and our psyches. All creatures have gone a little kooky on the planet. Not because they themselves created a disorder, but we have. If you look at Africa, as an example, we talk about monkeys, well, Africa is a great place to start. That was a lush rainforest continent. And if you go there now, because of what mostly Europeans did, you know, not the Africans themselves, but Europeans, they came and destroyed the entire continent and made arid lands where jungles used to be. Now, when you take monkeys that pervaded this entire continent, and the world pretty much in warm climates, and you start to now put them into areas where they used to have millions of acres, now they have hundreds of acres. That alone does what going to jail for a human being does to us. You know, so they start to get on. So a lot of cultural and social abnormality happens, as it does with people in major cities, where in the countryside, unless you're a little ignorant, you're not going to have the violence level that you would in New York City or London, England, or Paris, France. And the same thing happens with that community, because although these are not humans, they have a very strong genetics similar to ours, almost identical to ours, to be 1% difference. And with that said, you're going to see abominations. Orangutans, by the way, have never done it. They've never observed an orangutan. Now you look at orangutans, areas where they live, and they pretty much live in a much more serene, natural environment, and without the stresses that these chimpanzees have. You look at a gorilla, other than for violence, they don't eat another gorilla, but a gorilla, you don't piss them off. And what a gorilla pretty much eats all day long in the wild is sprouts. They actually will take the bottom of a plant, wipe it off the dirt, and eat that, not even the greens of the plant. They somehow instinctually understand that that's where the nutrients are, in that sprouted area of it. But you're going to see abominations occur, just like you do with people. I mean, you turn on the news, and every day somebody's shooting somebody. You know, the other day I saw an interview with a little girl where she watched her entire family shot by some lunatic. And it seems like every day, every other day, this is happening. And don't tell me that that always happened and we didn't know it. More of this is happening. As we have 7 billion distorted minds on this planet right now, you're going to see it. And these poor monkeys and primates are subjected to the same insanity.
Yeah, absolutely makes sense to me now. Great point. Now, talking about one of the things I enjoyed what you're saying about exercising and having oxygen condensers. I have one upstairs where I do my workouts in. But one thing I was really interested that you said is about sleeping with the window open, or even when you're driving, you lower the window because you get a little bit of fresh oxygen going through. Now, my thought was this, and I don't know if you've ever thought about it. When I'm in a sauna, and you're in the sauna and you're locked up, I actually drilled a hole to put my oxygen condenser in there so I could get oxygen through there.
Smart guy. Smart guy. I tell people to do that. So you're right on. Okay. Good thing. See, good. You have it. Your instinct is good, because that's just as good, frankly, therapeutically, as getting on the exercise machine and heating your body up. So I don't know if I gave you these numbers, but when I was looking into all of this years ago, recognizing that about 25% of the public has claustrophobia, and they'd never get into a hyperbaric chamber if I shot them. So basically what we did is pioneered infrared heat outside on a table, and not outside, but without an enclosure, and put the oxygen on. And the two doctors, the infrared guy and the oxygen guy, both told me the same number, or approximately the same. There's 120 times more uptake of oxygen if you're in a sauna inhaling it than if you just inhaled it. As a matter of fact, you get very little therapeutic, no therapeutic value just inhaling oxygen. So years ago in California and around the world where they had oxygen bars, they were placebo. They weren't giving you less cancer or less viruses, but who cares? Placebo makes you feel good anyway. Yeah. And the fact is, when you get into a sauna, it is therapeutic. So when you get onto an exercise, it's therapeutic.
So what do you think about this? Because I basically, you know how they have the things that go up your nose. I ran up through, and then I started thinking maybe I'm heating up the hose and I'm getting the vapors as well. So I just cut the hose off and stuck it into the wall and drilled a little hole. Is just effective to get the oxygen in there than you know, putting it directly up your nose?
That's a good question. That's a good question. No, it would not be as effective, but you're thinking smart. You're thinking smart because that's a very loose plastic. And so if you heat it up enough, now if it's just an infrared sauna, you're probably not going to have a big problem because the molecular structure of the plastic isn't at such that it would completely outgas. Where if you were in a normal sauna, that's like an oven, that would be a major problem for you. Okay. But if you just put that little tube in, it's putting minuscule amounts of oxygen in. So that's why you have to direction it. You have to put it directly to your nose. But it's smart thinking. I never even thought about that. Realized first time I thought about that.
Well, good. We're getting each other stimulated, which will move into the area that we're going to talk about sex later. But you know, being that you're talking about cardio and how important it is, and I think that you did a wonderful. There's a lecture on YouTube, and it's called Dr. Brian Clement and Exercise. And when you break it down, about 5 generations ago is the first generation where we really disconnected from exercise and the biological and anatomical exercise and connecting with the earth as far as the foods we did. But I was curious if you've ever done any of the studying or followed any of the work of Dr. Phil Campbell, who's talking about doing the intervals and getting growth hormone to increase by 500% by doing the intervals and jacking it up as far as getting your growth hormone going compared to just regular cardio. I'm not sure if you've done any of that study.
I know of him, but I don't know enough about it. As a matter of fact, if you could turn me on, email us, and I'll study, and maybe the next time we talk, I can give you an opinion. Yeah. To me, one of the most important, and let's flip the page, because we're not going to talk about the biological effect of this, we're going to talk about the emotional, psychological effect of it. A colleague out of Harvard, Dr. R-A-T-E-Y, to me, wrote one of the most important books in history on exercise, and it's called Spark, S-P-A-R-K. And he stunned us, floored all of us who thought we knew a lot about it, when he came up with study after study that showed increase of IQ, elimination of ADD, dyslexia removed. I mean, we know one thing: when I can get people to do aerobic exercise here who are depressed, light to moderately depressed, by the end of the 21-day program here, 1/2 of them no longer have depression. And it's not because they're doing anything exceptional other than the exercise. Yeah. And so I'm a major fan of it. As far as, I've studied deeply the work of Dr. Cooper, his 45, 50 years of work, and others in Europe. And there's such mass evidence that it adjusts hormones. As an example, recently, just today in class, I was teaching the health educators who are here that we now realize just from a year ago, a German study, that when you have muscle mass as you get older, that you literally maintain your hormones 3 to 4 times longer. So if you had muscle mass at 100 years old the day you died, your brain, your libido, your heart, everything's going to be 3 to 4 times more functional. And what happens to most people, they get old and say, well, I can't exercise, or I don't look as big as I did when I was 30 or 40 years old, so I'm not gaining muscle. Where if you look at the work of an interesting guy who was actually the nutritionist at Harvard, and he was so incredibly effective at appropriating money, they hired him, a very unique move, as the president of Tufts University. And I had a sort of a love-hate relationship with him because in the Boston media, circus there. They ever wanted debates, they would put he and I on TV or he and I on the radio, because we'd fight like cats and dogs. But I always had great admiration and respect for Dr. Steer and the work he was doing, and then came over. And when they moved him over, the new president to Tufts, he was a genius. He said, look, one of the first studies he appropriated money for is to look at centurions. And I remember the ad inside of the Boston Globe that looked for 100-year-old people. The medium age he had, I think he had something like 18, was 102, a little less than 102 years old. And basically he pitted them against our then Olympic athletes, so 16, 17, 18-year-old kids. And he found out that at 100 years old or 90 or 80, you develop muscle the same way you do at 20. The difference, quite simply, is you don't maintain it. It doesn't stay on you. So a guy in my age, in my mid-60s, I have to go, as I constantly do, no matter where I am in the world traveling, and lift heavy weights 3 days a week. Now, do I keep the mass and the bulk like I did when I was 40 and 30? The answer is absolutely not. But do I have muscle and structure? Yes. And is my brain and body and libido and everything much better? And the answer is yes. So those of you listening out there, as you age specifically, other than keeping healthy weight on your body, it is powerfully important. It's essential that you do this for your every other reason too.
Nice. All right. So I think you'll really enjoy it. He did an interview with Mercola, and he talked about for the last 30 years they've been doing it, and after every single session they test their growth hormone levels, and they're up, between 500 and 700%. And so it's pretty interesting. So I think you'll like that. Here's another thing I think about as far as the shower filters. Now, if you took one of those shower filters, because I know a lot of people are tight on money and things like this, and those shower filters can get kind of expensive. And I know that over time they can gather bacteria. If you took one of those shower filters and you basically put it in an ozonated water, would that do anything to the carbon in there, or do you think that that would be a means to kill off the bacteria so that you could continually reuse that?
I think you'd probably get about an 18-month shelf life in most public water areas. Okay. If I looked at Europe and North America, I think that it would be safe to say that would be an effective way to deal with it. The problem, quite simply, is that the drinking water is so horrific today with plastics and pharmaceutical drugs that you've really got to go to distilled water unless you're wealthy. If you're wealthy, there's guys from your area, from Santa Barbara, that fly in. A friend of mine just got this, and he literally creates the system for your home. And that takes everything out. So you can bathe in it and water in it, watch your vegetables and drink it. But most of us, including Brian Clement, I don't have that. I use distilled waters.
Okay, well, that's the same way. So here's a protocol that I use, and I'm just curious on your thoughts about it. Well, the first thing I do when I wake up in the morning, I have these, these liter bottles, and I drink a lot of water. So the first one I start off, and just as an overall, would this be enough water, is I start off with lemon water. First thing in the morning, fresh lemon off my tree. And then I go to coconut water. And I'm curious about your thoughts on this, because I know coconut water has sugar in it, and I know that, it's supposed to be one of the best things for you. Yet the sugar aspect of the coconut water, I'm confused about it, because I know that you don't advocate sugar. So I'm wondering if you could expand on that a little more.
Let's explain that. Let's explain it to you. Number one, most listeners don't know that lemons literally have more sugar than half the oranges. Now, the difference is they're tart, so you don't taste it. The difference is we put 1 lemon into a quart of water, so even when I tell people with cancer, don't take any sugar, I don't mean that. Drops of lemon juice in water is fine. Okay. Now, we go to coconut water. We collect coconuts from the trees here in Florida. Matter of fact, every Wednesday, we get coconuts, cut them open, and give them to the guests here at Hippocrates. Now, with that said, if you look at the coconuts from the east, they have a much higher sugar content than a Florida coconut, a Jamaica coconut, an African coconut. And why the way they hybrid those coconuts over decades or over hundreds of years, I assume, basically they have a higher sugar content. But with that said, even that type of juice, even if you cook that type of juice and get the coconut water that's cooked, it's so advantageous with minerals, and it has so many amino acids in it, it regulates a small amount of sugar that's in there. Now, there may be rare cases where I have flaming diabetics that I'll say, hey, don't take that. But that's even with diabetics, that's 1 in 50.
Okay. Okay, good. That was confused for me. And now, before I go to the gym, I do a teaspoon of sodium bicarbonate. Is that a good way to get your body to assist or maybe a better performance in the gym?
It is, because what it does is help circulation and alkalize the system. And you're not going to get a big kick out of that, but the fact is, for a number of years, our past physicians were actually IVing that as a underlying factor with other things, whole food nutrients we put in. And we saw great results with that. And endurance and stamina was one of the things that we kept recognizing.
Okay, good. And then after that, I go basically after my sauna, I do sea kelp powder, which you said a tablespoon has more calcium in it than I think it was like a glass of milk or something like that. Is that accurate?
Exactly. An 8-ounce glass of water with kelp in it, 8-ounce glass of milk. Let me tell you, the kelp hands down wins. But let me give you some numbers. If you took, as an example, 100 calories of milk that you and I and everyone else listening was convinced was the gold standard of calcium. 100 calories have 245 milligrams of calcium. Now we go to something that really has calcium. You take arugula and take 100 calories of arugula, it has 1,400 milligrams of calcium. Spinach has double, and the list goes on. And right next to arugula is watercress. That has something like 850 milligrams of. So when you start to look at all of these different things, we've been misled. I have a book that will be coming out hopefully by the end of this year, beginning of next year. It's dairy deception, and it not only takes milk into account, but since we Americans go to the dairy section to get eggs, I talk about eggs and milk. And the horrific data and information that comes out in stockpiles, almost on an annual basis with this, it stuns me. These used to be rarely researched subjects, where today they've become highly interesting to the research community. And you're going to see a tidal wave of switching into this direction over the next 20 to 25 years. Because when all the bells and whistles have failed, when all the propaganda and the mythology is gone, when you can't lie anymore and get away with it, they're going to have to flip to something effective. And that's why you're seeing this data and information and legitimate research coming out. And if you look, it has so many reasons not to consume it. From the obvious to the less obvious. And look at the work on cancer. That was even stunning to us. We were proud that we hadn't given dairy to anyone that's come here for 60 years, but we didn't know really until 1990 it was the #1 dietary cause of cancer, until Dr. Campbell came and told us that. And when I met Campbell, I challenged him on that. I don't just take things verbatim and say, well, gee, because he's a great guy and he's a smart guy and he's a top guy, doesn't mean I agree with everything people say. He had me understand it in 5 minutes. I became absolutely convinced he was correct, and more convinced now because we have the privilege to speak on the same platforms many times. If you look at the work that was done recently on prostate cancer, I actually published this in the latest Hippocrates magazine, and it basically shows the direct link pathways that prostate cancer is either propelled or even in part created by dairy consumption. Breast cancer, on it goes.
Okay, good. And then the last two questions that I have is basically the apple cider vinegar, and I've just started drinking this blue-green algae water that I've seen Dr. Kassar has been, kind of putting out there, and I'm wondering and those are the last two on the water subjects, if you think that those are, good, to get
let's
the
go
water.
Green first. I'm a major advocate of blue-green algae. I've been taking it for 35 years myself, fed it to all of my four children and now my 4 grandchildren. I can't emphasize, after giving it to tens of thousands of people, the benefit. It's the highest protein food on the planet. It has minerals, trace minerals. It has the only food on earth that has the exact essential fats your brain's made of. It cannot be bad. I can just tell you that. And there's only been one, quote, health authority that somehow had a distaste for it and put a whole lot of misinformation out about it. I wish they had talked to me, because I can tell you the opposite. We do, again, here at Hippocrates, clinical research on all the guests that come through. And from that, we glean a lot that you wouldn't do just by having a personal opinion about it. Then we go back to what's the first question? So I get it very...
The apple cider vinegar?
Apple cider vinegar. It's funny, that little book was found in Vermont in a used bookstore. and I think 10 people had read it. And this guy republished that book. And the last I looked, millions of copies were sold. Now, the good news is they were right. It alkalizes the body. Lemon juice, which you're doing, thank God. And now, obviously, raw apple cider vinegar, and a very small amount. If you have a quart of water like you showed me, pure water, you put 2 tablespoons in there, that's all you need. And basically, with that said, it alkalizes, like lemon, the bloodstream quicker, more effectively than anything else. Now, obviously, the apples hopefully were ripe, and usually they are, because the ones they can't sell because they're picked ripe is what they ferment into this. And number 2, the lemons, which obviously you'll pick ripe, but watch out if you go out to buy them at your organic store, because if they have any green on it or the top stem won't come off, you have to pull it off rather than hit it off. Basically avoid those lemons. Lemons are picked ripe pretty much. They found that unlike many of the orange companies that they spray paint them orange. With that said, I'm a big advocate of putting it in water like you, but you know what I'm going to say next. Never put it on food. Yeah. So the idea that raw apple cider vinegar, it helps to break down fat in the body, it alkalizes the system, it actually helps with reflux, auto-reflux disease, and I would render to believe that 6 out of 10 people, if they eat properly and do that, they no longer have this reflux. But don't put it on food. Now, why? Raw apple cider vinegar has the ability to go from high acid to high alkaline in a split second, and I mean less than a second. With that said, what we have to understand is that when you put it on food, and if you ask somebody, tell me what happens when I put vinegar in your mouth, they say, my mouth puckers. When it's puckering, you're not only killing the bad guys in the mouth, the microbe, but you're killing the enzymes. They're going to help to digest the food. So if I saturate my salad or whatever it is with vinegar, you're going to impair the digestion of that food because the enzymes are no longer going to be there that break that food down. 80% of carbohydrates, which all of you should be eating lots of, vegetables, fruits, things, grains, beans, sprouted ones, literally digest in the mouth. 80% of all the foods you should be eating are digested in the mouth, providing you have the enzymes there. No raw apple cider vinegar, and providing you chew. I preach to you to chew, and I still don't chew well enough.
That's a tough one.
The hardest thing people do is we swallow like, we're carnivores or something. Like we eat like a dog can eat because they don't need to chew.
Well, if you said at my family, you either ate quickly or you didn't get food. That's
exactly. Yeah, and that's really true. How many kids did you have in your family?
I don't have any kids. I have a sister, but I have a dad who's formidable.
He was a mom. A quick eater.
Yeah, big time. Yeah, you learn that real fast, especially playing sports and all that. You eat your food quick and get on. But yeah, that's one of my vices I'm continuing to work on as well. It's a challenge. And then the last question is, now you talk about the blue-green algae. I'm getting ready to actually start harvesting or start actually growing my old spirulina. And I'm wondering, you consider spirulina in the same category as the others?
Yeah, it is a blue-green algae. And I don't know the form you're growing. I know right now, so much, I'm taking it, but there's a new form of spirulina, blue-green algae, that the way they grow this, it doesn't have a hard shell on the outside of it. Now, if you write me, I'll get you in touch with those people so that you can talk to them. They may say, here's how you grow. And they grow this in man-made vats. The difficulty you have with most spirulina, other than Klamath Lake, which grows in a unbelievably mineral-rich saturated water, where that, through evolution, that blue-green algae didn't grow a hard shell on it. It has a carbohydrate-based cell wall. So you can give it to a baby and it digests it. Whereas the other spirulinas with this hard shell, unlike chlorella where they break down the shell, I don't know of any company that does it. So yes, it has nutrition. Yes, it's the same as the ones that have the no shells on it, but you can't digest the darn thing. So what you're growing, I can't comment on. I don't know. And you may be the one lucky guy, but I can write to me and I can get you in touch. And at some point in the future, when the E3 Live company is finished with their research on this, we'll let you know. But at this point, it looks like this is 70% protein. Okay. Formerly we thought it was great stuff at 54%. 70% knocks your shoes. And I'm not one of these blessed guys that, when I take things, I usually don't feel a difference. This one I'm feeling a difference. I've been taking it about 2 months now.
Yeah, I'm a big fan of them. So I appreciate all that info. That's my own personal kind of going to get in your head thing.